Assalamu alaikum. Hello everyone. This is Dr.Nafiz from Bangladesh. So today I am going to talk about a topic which is required for MBBS first year, post graduation aspirant, and so on as well. So this is the first topic that every student has to go through whenever it's about the thorax. The most important part is the heart, and to know the heart, the basic starts with or initiates with pericardium. So what is pericardium? Basically pericardium is, it's written here, it's a fibrous sac that surrounds the heart and the vessel and the root of the great vessels. So whether it's mentioned, I will also acknowledge the fact that it's mentioned it's a fibrous sac. So it's not only fibrous or serous. There is a outer layer which is the fibrous layer, there is a tough connective tissue. Beneath that there is a serous layer which is also covering the heart. So the fibrous layer, then coming from outward to inward, the fibrous layer, then coming the serous layer, in between which there is a pericardial cavity that contains 50 ml of serous fluid. So this is the parietal layer of the serous pericardium, and the layer of the serous pericardium which is surrounding or closely adherent to the heart, that is the visceral pericardium, that is also known as the epicardium. And just for an added information, if I go from outward to inward totally into the cavity of the heart, that will be the fibrous pericardium, that is the green marked area here. The blue marked first area is the parietal layer of visceral pericardium, the parietal layer of serous pericardium, and the black mark here beneath the red mark of the heart is the visceral layer of the pericardium, visceral layer of the serous pericardium, which is also known as the epicardium. Here the students get confused which one is the epicardium, which one is the pericardium at inter level, as we are always being taught about the layers of heart is like pericardium, epicardium, myocardium, endocardium. So that's the difference. It is the epicardium, and below this is the muscle layer is the myocardium, and the interior of the heart is the endocardium. So that this is all about the layers of the heart from outward to inwards, including the pericardium. An important fact is that the position, and another interesting fact, this is fibroserous sac, not only fibrous or not only serous. Heart is a very important structure that needs to be overprotected. So Almighty has given the fibrous layer, that is the tough connective tissue outside just beneath the sternum, and otherwise all the coverings of the bodies, for example pleura or peritoneum, these are only serous. What is the relation? The relation I will also clarify it in the next page. It is just posterior to the second or sixth costal cartilage, anterior to the thoracic vertebra. This is something that is about the pericardial layers. Now to get a crystal clear idea about the pericardium, so just look up to it. Anteriorly, this is a lateral view. Okay, suppose you are looking it from side. Okay, just this is a side to side view, you are looking it from a side. So this is the sternum, manubrium, and the body. So the heart is attached anteriorly to what? To the sternum. So sternum to pericardium, there will be sternopericardial ligament, and these are the superior and inferior sternopericardial ligament, these are placed anteriorly. So the anterior attachment is superior and inferior sternopericardial ligament. Now what is at the posterior surface? When we will go through the oblique sinus, we will see that there will be at the base of the heart or the posterior surface of the heart, there is something called esophageal impression, because below that there are two tubes, esophagus and trachea as well. Anteriorly trachea, posteriorly esophagus. So there will be trachea or bronchi and esophageal impression as well. So these are the anterior and posterior relation. Superiorly, just look at it, it's a very interesting factor. Superiorly, the fibrous pericardium gets blended with the adventitia of the great vessel. Okay, means there is no serous layer of pericardium. The fibrous pericardium directly gets in contact with the adventitia layer of the adventitia, that is the outer layer of the great vessel. Now the important fact is, why it's adventitia, why not serosa? We know it pretty well. What is the difference between adventitia or serosa, or I will later on discuss it on the topic of abdomen as well, because there will be while studying about the ureter or the urethra. That's a common phenomenon, or the bladder, whether it's a serous layer or it's the adventitia layer. Okay, so that is connected with the or blends with the adventitia of the great vessel, and furthermore there are pretracheal fascia as well, as the trachea is goes over here at the posterior level, so the pretracheal fascia covering the trachea also gets blended with the fibrous pericardium superiorly. Inferiorly, it's attached or continuous with the central tendon of the diaphragm. As you all know that the central tendon of the diaphragm and the fibrous pericardium are same in origin, same in developmental origin, that is from the septum transversum. So you cannot insert or poke your fingers from inferior area, okay, or it's blended. You have to cut through a margin, or you have to cut through something so that you can poke your fingers inferiorly. Now important thing is laterally. We always know the relation of vein, but there is not vein, not vein artery nerve, there is rather vein, nerve and artery. The vein is the pericardiophrenik, the pericardium, and the phrenic, that is the diaphragm. So pericardiophrenik artery vein, then there is a phrenic nerve. The phrenic nerve that supplies the somatic sensation, that also supplies the fibrous